This program is brought to you by the University of Central Florida's College of Medicine, celebrating the graduation of its charter class of 2013.
Entonces no tiene ningún otro síntoma, nada más el dolor de barriguita. We've seen kids with a lot of parasites and just issues with stomach pain, decreased appetite.
She probably has some degree of heart failure. She has to sleep sitting up. She's not eating well. Much of what we're bringing in are Tylenol, ibuprofen, things like that.
Coming from the United States, many of our students never have an opportunity to see third world healthcare.
A lot of the patients are not receiving care on a regular basis and might have even gone years without care.
It's a whole lesson in cultural competency, it's lessons in medical Spanish, it's learning how to diagnose and treat on your feet, on the ground.
This is really going to be a challenge. We have to get really creative right now.
They were trying to put up the lights.
I mean, it's definitely primitive. You're worried about the iPads getting wet, all the electronics getting wet. It's not ideal, not ideal.
Ha mediado la Universidad de Sevilla. Buenas tardes. Buenas tardes. Buenas.
We are in San Francisco de Macorís in the northeastern part of the República Dominicana, in the Dominican Republic, at the very beginning of a short-term medical mission trip with the University of Central Florida, College of Medicine and College of Nursing.
Los azules para los caballeros. Del otro gobernador.
It was moved by the rector of the school because of his ability to interact.
They meet with the trip organizer, Dr. Esmerdoc, to go over the schedule for the next few days. After arriving at the hotel, work begins in earnest to organize the students and plan the clinics.
Just really trying to, make space as efficient as possible.
The hundreds of pounds of supplies the students brought with them were paid for with money they'd raised or from donations.
So we're going to be able to give basically everyone who comes to the clinics something to walk away with that's not just medication.
There's even something for the younger patients.
So stickers inexpensive. What kid doesn't like,
Much of what we're bringing in are vitamins and medications to treat aches and pains, Tylenol, ibuprofen, things like that, that are very difficult for patients to purchase here. Things to address childhood malnutrition, vitamins for kids, prenatal vitamins to prevent birth defects.
For the first time, the team will create electronic medical records for the patients so that their medical history can be followed.
One of the major reasons why I decided to go on this mission trip was the experience that I will get seeing patients. A lot of times through the medical school we do get experience seeing patients, but it's only once every 2 or so weeks. So being able to see the mass quantity of patients here and the variety of needs here is one of the major reasons why I came. Another reason is the medical Spanish.
The students are eager to get started, but Dr. Sim Sendan tempers their enthusiasm with the realities of what they can really provide.
I think that actually the treating the patients is probably the least they get out of it. Medical students today spend a lot of time concentrating on how to take a history and how to do a physical exam, and they spend time in clinics that are well equipped with every lab at their disposal. And they don't really get a chance to see how people live and in the communities in which they live. And this puts them completely outside their comfort zone. It's a whole lesson in cultural competency, it's lessons in medical Spanish, it's learning how to diagnose and treat on your feet, on the ground, without a lot of lab studies and things at your disposal.
I think I want our students to come away with an appreciation of all different types of patients, of all different types of care, recognize how much they have and how much that they can give, that it's kind of rewarding to take care of patients in underserved regions. If they can come home with that, that'd be really great.
My expectations of what I can bring to the community are limited in a one-time trip. I know that I am not going in there and curing the ills of a community by showing up for a day with a bunch of medical students.
At the top of the form, put what room number you're in. Make sure you fill that out because that's how we're going to track patients. Thanks everyone for coming this morning. We're going to go ahead and get started.
The team is filled with anticipation as they arrive at their first clinic site, which is a local elementary school. Medical, nursing, and local Dominican Republic medical students who join the mission trip will work together over the next few days.
Dar un solo ticket y poner una persona aquí con un ticket. Cuando lo remite,
De los signos vitales y determinar qué problema tienen. We're expecting at least 150 patients. That would be ballpark minimum, but as much as 300 or more. And definitely, if we have time, we're going to make house calls and go and see and make sure that everyone knows that we're here.
A lot of the patients are not receiving care on a regular basis and might have even gone years without care. So we might be seeing a lot of chronic diseases that are presenting late in their course. Another thing we're going to keep an eye out for are any wounds or acute care that will be required here because the patients don't have the opportunity to be seen very often here. Gynecologic issues are things that a lot of people aren't very forthcoming with and sometimes aren't very willing to discuss, especially in the Caribbean and Latin American culture. So we're thinking of setting up a separate private triage for women where they can express any specific concerns they have in respect to reproduction, gynecology, obstetrics, and so then we can really start to delve into those issues.
We always bring sheets and clothespins with us, and I'm very fortunate that I actually have a 2-room suite for my gynecology office where I can talk to the patients. And this is my exam room where I have a table and I can examine my patients. On top of the thank goodness, most of the Dominican women are not very tall and they can fit on these tables. We always bring with us yoga mats. So this is a yoga mat, and I bring table paper that we use in normal clinics and sheets so the women can cover themselves up. We'll close the blinds. I have with me a very small ultrasound machine that is fantastic, that lets me examine patients if I need to look at a baby and check for fetal development, look for ovarian cysts.
Am I nervous now? It's always a little exciting. It's not nerves, it's more of like excitement and just anxious to get my hands on and when working with the patient. So it's very exciting for me to be here.
Conditions are cramped and hot, but that doesn't deter the locals from waiting patiently outside in the heat for hours.
Que estamos esperando, todo lo que sea sin su información privada es privada para normal dolor de barriguita. We're seeing sort of like the same thing you're probably going to see in we've seen in every trip. Kids with a lot of parasites and just issues with stomach pain, decreased appetite. So things like that. Women with a lot of vaginal issues and hypertension, diabetes, you always have those. But those are, typically under control. We don't like to start people on those meds. We just like to continue their care. So minor thing, fungus on their feet and just things like that. So that's what we've been seeing. Your typical primary care issues. I don't have a count off of my head, but I'm sure we've seen upwards of 75 to 100 patients so far, and it's only midday, so it's been very nonstop.
Occupying the east side of the island of Hispaniola, which it shares with its neighbor Haiti, the Dominican Republic is trying to diversify its economy, including tourism. But it still relies heavily on agriculture, and the cocoa crop is one of them. Despite infrastructure improvements and the country's economic growth, rural communities are plagued by high unemployment and chronic poverty. These factors have a direct effect on health. Many of the residents don't receive regular health care due to the cost or because they don't have transportation to get to town. River water is used for bathing, cleaning, and cooking, causing parasites and other hygiene issues. And riverbanks are often used as dumping grounds for trash. And many rely on cheap foods that offer little nutritional value.
es muy importante para toda la gente.
So educating the people about hygiene is equally as important as the medicines and medical skills the team brings.
Many of our students never have an opportunity to see rural health care, so this is something for them to really appreciate, the care that we deliver, what we have in the United States versus what other countries don't have.
Tell him that he possibly have acid reflux or mild gastritis.
El estómago, lo que usted le molesta.
Students new to the mission trips begin to hit their stride and put into practice the clinical skills they've learned.
Well, today I'm working with triage. I'm helping assess the patients when they come in, take blood pressures, vital signs, and then finding out what their chief complaint is just to determine where they need to go and who they need to speak with. I was apprehensive at first because I wasn't sure where I would fit in and what exactly I would do, as I feel we all kind of did. We have all started to find our role. Ultimately, I'm excited of what I am capable of doing, and it's made me feel a lot more confident in my abilities.
Although this patient has a local doctor, she came to get a free health checkup, which she said was better than she expected. As patients continue to be seen, Dr. Sim Sendan reaches out to the residents who can't make it to the clinic because they're too sick to travel or have no means to get there.
She may be stuck in the chair and very ill, but that woman has control over that family, us down to the youngest child. She's kind of the matriarch of the family, and they brought us here to see if there's something we can do. She has what's called barrel chesting, and her respirations are very labored and very shallow. She probably has some degree of heart failure. She has to sleep sitting up because she can't lay down or she gets too short of breath to breathe. She's not eating well. There's nothing really I have here that's going to alleviate her suffering. So we talked about that. I gave her some Tylenol, some acetaminophen that would hopefully alleviate some of her pain. I'm scared to give her anything much stronger than that because I'm afraid that she'll get an ulcer or more complication from it. We gave her some vitamins. Maybe it'll help her make some red blood cells a little bit extra. Maybe that will help. But I was very honest with her and told her that my resources are fairly limited and that I don't think there's a magic cure for this at all.
Despite her best efforts, she can only prescribe basic medications to alleviate their symptoms. She can't give them anything that requires monitoring or follow-ups or medications that the patients can't afford in the long term.
How fast? We go very fast. Okay. Well, I got bananas growing. Okay. Okay.
Sometimes it's just about being able to reassure the patient about their condition or give a second opinion.
Sí, y toma. Felicidades. This is the extreme dichotomy of a Latin American country where you do have some wealth in the cities and industry and things that are developing, but then you get out here and the housing is limited at best, and it's outside latrines and no electricity that I'm seeing. Señor, me voy a sentar a su lado a la derecha. A su corazón. Me llamo Doctora Judy.
This is a gentleman. He's along the lines of 90 years old, and what you'll find is with older folk, they're not really sure when their birthday is.
Did they put something here when they're not here to make sure that he doesn't fall or hurt himself? No, that's okay.
He probably has something along with dementia and Alzheimer's. He's not oriented to person, place, time, location. But other than that, there's nothing much we can really do for him. He's, old age, and he's ambulatory, as you can see. He's walking, so he's doing really well in that sense. No really real complaints. He has hypertension. They respect our elderly very much, and so everyone kind of takes care of them. This is actually one of the poorest that I've seen. Usually it's never been this bad, I don't think. So this is probably one of the more rural, poor areas you will find.
Even in the city, hospitals are far from what we're used to in the United States, with overcrowding and few resources.
It's very different from the U.S. I mean, it's hot. I mean, that's the first thing that you notice when you walk in is that there's a wall of heat, and you see a room with like 7 patients in it, whereas in the U.S. you have either your own private room and you have a window, and here it's just and curtains. Curtains are huge, but here there's no curtains. There's beds and there's interns running around and residents running around, and everybody's working really hard, just the same as in the U.S. It's just, you know, the walls aren't as white and it's a little bit hotter. But you do what you can to take care of patients.
We do what we can with what we have here, and we're trying to give the patients such of what good health.
In the U.S., we're used to getting everything that we want, everything that we wish, and sometimes we don't need. Because they see different perspectives. They see how care is delivered in other health systems. They see how other communities are functioning and delivering decent health care with very limited resources.
Using the hospital as an example of how to make the most of available resources, the team comes up with ways to deal with the challenges of their makeshift clinics.
If we need to do some examination that's need to coverage, then we've been using the sheets to give the patient more privacy. And it's been working very well. We needed to do that a couple of times to listen to a lady's lung and to examine the gentleman's hernia, and it has been working very well. In the US, you have your own room, you have your own nurse, you go into the room, everything is set up for you. In here you have 4 providers around, you have a lot of noise, but again, we were able to adjust and adapt, and there's been really good experience and good learning for everybody. Between the two, between the femur and the tibia, you can grind it. Hurts? You have limited resources. You have to rely more on your clinical skills and medical judgment. I'm actually grinding the 2 surfaces against each other.
A local TV station helps get the message out about the free clinics. And Miami-based volunteer Dr. Ausberto Hidalgo lets residents know what services are available.
Even though UCF comes once a year for now, what we're doing is we are integrating the UCF program that we're implementing here with the local hospital, which is called San Vicente de Paul Hospital. And this patient are going to be followed up because we have also the interns and residents from San Vicente de Paul Hospital are going to continue to care for this patient as an outpatient.
3 days into the trip, and the team travels to the most rural site yet.
This is in the mountains somewhere, San Francisco Jaya. It's raining, as you can tell, and this is going to be a really big challenge because this is a very, very small, rustic schoolhouse, and I don't even think we have light source at this moment, so it's going to be a challenge to triage patients. We have limited area to actually examine patients. This is really going to be a challenge. We have to get really creative right now.
Probably 1 table of triage for women in my room, and then I'll be in a separate area where I'll be doing consultations and have another group of students doing the consultations with me.
The bad weather and stark facilities test everyone's ability to examine and treat the patients.
Trying to put up the lights back up and connecting it to the generator so that we can get lights in here because it's a little dark. It's raining out and we don't have any lights.
I mean, it's definitely primitive. When you look around, we're in these dark buildings trying to see these patients. It makes things more difficult with the rain, especially you're worried about the iPads getting wet, all the electronics getting wet. It's not ideal.
I'm concerned about being able to assess the patients effectively. I mean, I do have a flashlight and I'm going to use that, but I mean, if there's a rash or something that we really need to lay eyes on, it's going to be difficult to do. So maybe even just bringing them outdoors, and if it's cloudy, I'm not sure what we're going to be able to do. I'm a little concerned today.
I've been interviewing the patients. I've been doing a very thorough assessment on them, as a nursing student, and I bring something different, but I've been learning a lot from the medical students, both from the U.S. and the Dominican Republic.
Some people stop by just in the hope of picking up some basic toiletries and not to see a doctor. So they are handed out to everyone to help shorten the lines. It's a race against the weather, as Dr. Sim Sendan tries to see as many women as possible before day's end.
I've actually had the opportunity to do a lot of counseling for sexual abuse too, which is something, it's awful to take care of women who've been sexually abused, but again, this is one of these things that you see in these communities a lot that is unspoken amongst the women because of shame and everything else, and I was able to counsel a lot of young girls too, which makes me feel at least useful because it gives them a chance to express what happened.
She uses the principal's office as a private exam room, as it's the brightest of all the rooms at the schoolhouse. The portable ultrasound machine gives the expectant mother a glimpse of her unborn child and reassures her that the baby is healthy. When the skies clear for a couple of hours, more people arrive. They're given numbered tickets to ensure that they're seen. But the incoming tropical storm and a sudden rush of patients means the team reluctantly has to turn people away. Rising water levels could mean that their bus won't be able to cross the rushing river. Dr. Luis Esmerdoc stops by to tell the team that they must end the clinic early or risk being stranded in the mountain community.
Eso es la Puebla más pobre.
Ya lo malo pasó.
I mean, I wish we could have brought so much more because there's so many things that we can do for them, but we have a limited amount of pharmacy, we have a limited amount of supplies, we don't have an EKG machine, there's things that we are limited in being able to do.
I love to teach, and here I'm working with students from different kind of backgrounds, working with American students, second and fourth year, working with students from here who are the last year of their medical education, of their medical school, and it's fun, it's very rewarding, and I feel the students are appreciative too, trying to push everybody a little bit beyond their comfort zone, and they seem to be they're very sharp students, and they seem to be doing very well too.
If we plant the seed this early as their student, I feel that most of the people that come, you can see the desire that every student that has been here wants to come back and do it again.
I think first and foremost I'm an educator, and I love the aha moments in the students' eyes when they get that feeling that they are speaking Spanish, sometimes for very intermediate level speakers, and they're able to communicate with the patient, or they understand how poverty is affecting the people in the community. And they're out of the country working as a team, trying to see lots of patients in a short period of time. They get a new sense of the capabilities and the approach to care from each other that they wouldn't have otherwise.
These individuals wait hours and hours to see medical students and a few attendings that we have with us, and they really need the help. They don't have access to a lot of primary care. They don't have the time, they don't have the access. So when they come here, they trust us with their health, and we take that very seriously.
This program was brought to you by the University of Central Florida's College of Medicine, celebrating the graduation of its charter class of 2013.